Testicular and other inflammatory disorders. Orchitis. Orchitis is the infection or inflammation of one or both testicles. Orchitis related to mumps usually occurs 4 to 6 days after inflammation of the parotid glands. Screening for orchitis is to be done for all boys who present with inflammation of parotid glands or mumps. Signs and symptoms include swelling on one or both testicles, fever, pain, tenderness, penile discharge, blood in semen, and leukocytosis. The treatment is antibiotics depending on the organism. If caused by STI or sexually transmitted infection, treating the other partner is necessary as well. Supportive treatment includes rest, elevation of the scrotum using scrotal support, ice packs to reduce edema, analgesics, and anti-inflammatory medications. Hydrocele. Hydrocele is the abnormal collection of fluids between the layers of the tunica vaginalis, which surrounds the testis. Swelling, pain, tenderness is seen, and the transillumination with a bright light shows fluid collection. Surgical treatment is hydrocelectomy, which is removal of the tunica vaginalis surrounding the testis. This is done only if the hydrocele is too large, uncomfortable, and the patient presents with circulation issues. Postoperatively, ice, scrotal support, daily dressing changes with saline and analgesics are given. The sutures are absorbable. The swelling goes away in a few weeks. Avoid intercourse and strenuous activity until okayed by the doctor. Testicular torsion. Testicular torsion is a rotation of the testes, that is, twisting of the blood vessels within the spermatic cord. There is sudden severe pain in one testicle, nausea, vomiting, dizziness, and scrotal swelling. Sometimes there may be blood in the semen, and the testicle is pulled to a higher position in the scrotum on the affected side. This is also referred to as high riding. When this occurs, the blood supply is cut off to the testicles and nearby tissue in the scrotum. Treatment is emergency surgical correction. Postoperatively, ice packs, scrotal support to minimize pain and to reduce swelling. The incision is observed for signs and symptoms of infection, that is redness, tenderness, purulent discharge, and analgesics will have to be administered for pain control. Varicocele. Varicocele is the abnormal dilation of the network of veins from the testis and the epididymis, which constitute part of the spermatic cord. The abnormal valves obstruct normal blood flow, causing a backup of blood, resulting in engorgement of the veins. Varicoceles are a common cause of infertility in men. Varicoceles usually develop slowly and usually have no symptoms. Painless testicle lump, scrotal swelling or bulge in the scrotum is noted. Dilated tortuous veins may be palpated above the affected testis when standing and usually disappears on lying down. The rush of blood can be felt in the scrotum when the client performs Valsalva maneuver. Other signs include scrotal pain, tenderness, and heaviness in the inguinal area. Treatment is varicocelectomy and is done laparoscopically. Post-surgery, ice packs to scrotum for the first few months. Dressing is removed after 48 hours. Non-strenuous exercise for the first 2 days. Scrotal support to decrease edema, pain control, and watching for hematoma and signs of infection. Avoid strenuous activity and sexual intercourse for at least 3 weeks and or until the doctor's advice or follow doctor's advice. Vasectomy. Vasectomy is otherwise the male sterilization. It involves surgical interruptions of both vas deferens and is done as an outpatient procedure. An incision or small puncture is made to expose the vas deferens and is cut. The cut ends are closed with absorbable sutures. Since seminal fluid is predominantly produced by the seminal vesicles and prostate, no noticeable decrease in amount of ejaculate is seen even though it contains no sperm. Vasectomy usually has no effect on sexual potency, erection, ejaculation, or production of male hormones. Patient is to be taught that vasectomy provides no protection against STIs and condoms are to be used as necessary. Complications to be monitored post-surgery include scrotal ecchymosis, swelling, superficial wound infection, and hematomas. Nursing management includes educating the patient about the surgery. Ice bags are applied intermittently to the scrotum for several hours after surgery. Wear snug cotton underwear or a scrotal support for added comfort and support. Sexual intercourse, lifting heavy weights, sports including biking or cycling, and other strenuous activity resumed only after 1 week. Fertility remains for some time until the sperm stored distally in the seminal vesicles have been evacuated. Sterility typically is achieved after 10 to 20 ejaculations. Use contraception until confirmed by the examination of the ejaculate specimen. Testicular cancer. This is the most common cancer among white men aged 15 to 35 years. This is highly treatable and curable if diagnosed early. Classification of testicular tumors: germinal and non-germinal. Germinal makes up 90% of the tumors and develops from the germ cells that produce sperm and is usually localized in the testes. Non-germinal makes up about less than 10% and develops in the supportive and the hormone-producing tissues of the testicles. These usually metastasize early and are resistant to chemo and radiation treatment. Risk factors: undescended testicles or cryptorchidism. Testicles normally descend before birth, but undescended testicles move down mostly on their own by the time they are 6 to 9 months old. Positive family history: personal history of testicular cancer on the other testes, Caucasian American race, HIV positive men, exposure to chemicals in the mining, oil and gas, and leather processing factories. Manifestations. The signs and symptoms are subtle and usually go unnoticed. There's usually a feeling of heaviness or dragging sensation in the lower abdomen and groin. Enlargement of the testes without pain is a significant patient presentation. Painless lump or mass in the testes, painless enlargement, and heaviness in the scrotum is seen. Late signs include low back pain, generalized weight loss, fatigue, and abdominal pain, which may indicate metastasis. Early diagnosis is possible by doing monthly testicular self-examination and annual testicular examination by a physician. The treatment include orchidectomy or orchiectomy or simply orchi, they're all the same. Retroperitoneal lymph node dissection, which may be done open or laparoscopic, radiation therapy, and chemotherapy. Nursing management include assessment of physical and psychological status, providing emotional support for the client and family, respond to questions and encourage client to express feelings, address issues of body image and sexuality, encourage a positive attitude, monitor for complications post-operatively, that's bleeding, gapping, incision, signs and symptoms of infection from the incision site, pain control, this includes ice, elevating the scrotum using scrotal support, avoiding strenuous physical activity for 3 weeks following surgery. Patient education regarding possibility of preserving sperm in a bank before surgery to help relieve clients' fears about infertility is done. Orchiectomy should have no lasting effects on sexual or reproductive function. Monthly testicular self-examination and follow-up care must be continued.